Welcome everybody. My name's Anna Lawrence-Jones and I am the Patient and Public Involvement and Engagement Manager at Imperial's Institute for Global Health Innovation. And I'm joined today by three panel members, and our panel is talking about encouraging patient and public involvement in research and service improvement for medication safety. I'll let each of our members introduce themselves before they answer one of the questions. But first, I thought I'd give you a bit of a background about patient and public involvement in general in research and service improvement. So it's really important to involve patients, carers, and members of the public or public partners in research and service improvement, because a patient might be the only consistent person throughout their care, and they bring different experiences and knowledge to healthcare professionals and researchers. And they have their lived experience of their conditions, or their carers also have that lived experience and the experience with the healthcare system. So they can help in many ways throughout a research project. They could come up with ideas of how to improve a service or prioritize research topics. They can ensure studies are ethically sound and that services are designed appropriately. And public partners can really get into the research, so they can help develop research documentations, develop recruitment strategies, ensuring that seldom heard groups are recruited. And they can also be trained in actually collecting data and analysing data, like ethnographic data or analysing qualitative data, which some of our panel members have had experience in. And of course, public members can also help to interrogate the research findings and help to disseminate it widely. So there's lots of different things to consider when you're involving patients and carers and members of the public in research and service improvement. For example, you need to involve people with a breadth of experience and a range of backgrounds, including those from seldom heard groups. So it's really good to go out to where communities are, rather than expecting people to come to you, and think of ways that will help the opportunities be accessible. So paying people for their time, making sure there's appropriate training and support and safeguarding measures in place. So we always try and ensure that the environment we're trying to build, whether it's online or face-to-face, is very comfortable and welcoming for people to share their views. And if the topic might be something which might cause emotions or feelings in people, we might want to put in some safeguarding things in place, like having a clinician on call or mental health first aiders. And it's also really important to make sure we're capturing what we're doing. So what has changed in the service or the research project because of what public contributors have said. So we're really showing the value of their contributions and building to the evidence base. So I hope that gives you a bit of a background. And now I'm going to come to our panel to ask a few questions. So Della, if you'd like to introduce yourself first of all, and then talk about, as a public contributor or partner, what do you most value from researchers when they're working with patients and families?
Good morning, everybody. My name is Della Ogunleye, and I got involved in research as a result of being diagnosed with cancer about 12 years ago. So this got my interest going. Firstly, I noticed that there were lack of representation in the cancer field. So that's what got me into research, because most of the things, or for instance, the prostheses, they weren't for Black people, they were mostly for white people. So this is how I started in research, talking about unmet needs and things researcher needs to know from a community like me as a Black African in England. So what I value most when I'm working with researchers is that good relationship that I know is central to improving outcomes for patients and their families. And as a patient, we bring that expertise, that insight into individual research studies, because the lived experience of a particular condition helps, or those people using the health services, it's much better when you hear that from a lived experience point of view, someone who's walked through it. Sometimes it's not that the researchers deliberately don't want to know, but sometimes they don't know. So when you're coming from that patient's point of view of, this is how I think we could do things, this would be better outcomes for patients. And, you know, it's been well received because most of the times they're willing to listen and to learn and appreciate being there as a patient. And I think I will stop there and give John the platform to continue. Thank you.
Thank you, Della. So John, please introduce yourself, and then could you tell us a bit about your experience of being involved in a medication safety project and why you've chosen to take part?
Thank you, Anna. My name is John Norton, and I have come to this with absolutely no background in medicine, but indeed with a very long and consistent commitment to volunteering, certainly in areas that I feel hopefully are going to do some good. And I've also been a patient and public representative, what in the medical world we call a lay partner, in northwest London, because I live in central London for about at least the last 10 years. And for most of that period, I've also been a patient safety champion, working in particular with Imperial College Healthcare NHS Trust to foster a culture so that everybody working in the trust, in whatever capacity, are always acting and thinking in ways that are going to avoid harming patients. And now, happily, as you well know, Anna, this brought me in touch with you in 2017, I think I'm right, when I happily embarked upon a more academic approach to patient safety with Imperial College, who of course worked very closely with the trust. And very soon thereafter, with Dr. Sara Garfield in medication safety, and from her, of course, you're going to hear very shortly. But Sara, I think, will agree that she was very determined from the start to get her group of public partners, as we tend to call ourselves, or contributors in research, to get the group in which Della and others were involved from the start, and we got to know each other extremely well, fully involved from the start to finish in medication safety projects. And this included analyzing surveys or questionnaires, debating how the results should be formulated for maximum effect, and considering how the final paper should be disseminated. Also, much to my surprise and indeed delight, and I'm sure Della's too, being included as a co-author of the reports. I mean, I never, ever expected to get to that degree of involvement in academic medical work. First was a study of the extent to which patients keep a record of their medications on paper or in digital form, and the importance of doing so for their safety, and indeed for the general running of the prescription business and making certain that patients get the right medications at the right time and indeed are taking them. Then exploring the experience of patients during the pandemic, of being able during those difficult days of being prescribed and obtaining their medications in timely fashion. This, as I'm sure Sara may mention, produced widely differing experiences and the extent to which the barriers imposed by the pandemic affected safety. Lastly, and still ongoing, a study involving focus groups of both practitioners and patients to understand the unintended consequences flowing from the very necessary now introduction of new technologies. Here we took part in the groups, analysed results, assisted with the way the report was presented, rather as I've mentioned before. And the object is to formulate a strategy, and I'm sure this is of global importance, for how these consequences can be avoided and technologies be successfully developed and used in ways that will avoid the harms that the study reveals. This was, of course, wider than medication and covered all aspects of care. But I'm still mentioning it because I think all aspects of care, including medication, are in lots of ways linked together. what has occurred to me that all these three experiences concerned aspects of how human behavior is affected by external events, and how this can indeed itself affect their safety from preventable harm. Now, just coming to an end, I think in all these studies, we as public partners were treated as full members of the team put together by Sara and Professor Bryony Franklin, who was at the head of the projects. Our views taken fully into account, so the research benefits from a public as well as from a professional perspective, as indeed Della has mentioned. And along the way, we had great support, which is something that those involved in this work clearly do need. And the real success from it being a partnership comes when you built up complete trust and confidence between the researcher and public partners. And I can say that, and I have every expectation, Della will fully agree, that our relationship with Sara has developed in a very close fashion. And it's made it really enjoyable, and feeling that we really want to be involved. So I do recommend that those who have this kind of feeling at all do come forward and become so involved. I think, Anna, that I feel has given, I hope, some gist of the kind of experiences that those of us involved in this work can enjoy. And I mean enjoy.
It sounds like Sara and the team have done a brilliant job in involving you in lots of different ways throughout the project and making it a really enjoyable experience. Della, I wondered if you wanted to add anything about the sort of support or training you received, or anything else.
Actually, I want to add to that, because as a patient, even being involved, it empowers you. Sometimes even when I go, the last it wasn't the last project. I think it's when you have to, during COVID, when we had a topic, Sara, on getting your medication or something, trying to get it in advance before you run out. And that actually empowered me to always, like today, each time I remember Sara, is like, oh, have I got enough medication? I don't want to run out. So those things help you even in your own personal life. And some of the training, I think we did was it a qualitative analysis? And that was one of the best things I learned as a patient, a lay member. And yeah, Sara is always encouraging us, even if you don't understand. I think I remember when I started, when John said he has no medical background. I'm like, what can I bring to it? But Sara helped us and said, look, if you have any questions, come back to me. And she made it enjoyable. And, you know, we felt like we were learning, not that we were helping, we were learning, and it empowered us. So that's what I wanted to add to it. Thank you.
Thank you, Della. That's a really good point. I think not only does the research project benefit from your lived experiences and insights and comments and how you might analyze the data in a different way to a researcher, but you yourselves also learning and being, building your confidence. So I think there's lots of different impacts that might be on the project as well as on the researchers and the public partners themselves. So thank you for that. Hopefully it will encourage others to get involved in projects. I'll come to you now, Sara. So from the researcher point of view, what are the benefits you have experienced in involving patients, carers and members of the public in your projects for medication safety?
Thank you. So I have experienced great benefits, both in terms of individual projects, but also in the way that I've learned from John and Della and others, and developed myself as a researcher because of the input that they've had. So in terms of individual projects, an example would be when we were doing some observations looking at how patients and carers were involved in discussions about medicines on hospital wards. And we had some researchers who actually came onto the wards with us and joined us for some of those observations to give their perspectives. And one of the things we noticed when we were analysing everybody's notes is that the researchers as healthcare professionals and pharmacy people were very focused on those discussions about involvement of patients and carers with their medicines, which was what the project was focused on. But what we got from having involved the patients was this broader view of what did it feel like to be a patient in that whole conversation and on that ward and in that consultation. And that really let us see the put together the medicines related conversation in the context of how it was feeling to be as a patient in the whole consultation. And that gave us much richer findings than either alone would have given us. So that really informed the paper that we wrote and informed our results and our future work. In terms of impact that it's had on me as a researcher, I want to share two examples really of how I realised just how much impact it has had without me even knowing it, because it's such a partnership that I didn't even know that that's where the impact had come from. So one example is a researcher that I work with was doing some work putting in a funding application for medicines, adherence research, how people take their medicines. And she asked me if I'd review it for her because I've got some experience in this area. And one of the suggestions I made to her is, oh, as well as speaking to patients, why don't you speak to some family carers? And she came back to me and said, well, if they've got family carers, they won't need any more help. There's already help available for them. And I said to her, yes, but the family carers also are going to need support. And just because there's a family carer involved doesn't mean that they don't need an intervention as well. And I was a little bit puzzled by this conversation because it's a researcher who's very experienced and I have a lot of respect for her. And I thought, why did I need to spell this out in all this detail? And then it kind of, I had this aha moment. And of course, if this would have been 5 years ago, I would have been thinking the same way as her. I wouldn't have thought about family carers. But because I have worked with somebody who was a carer, who we got involved in the project because another public member told us we need a carer. We got involved with this carer and they kept talking about the carer's perspective that it became so embodied in the way I think that I didn't even know where it had come from. So for me, that's true involvement where you don't even know where it's come from. Just another quick related example is I was asked to help get some patient and public involvement members interested in a project and involvement. And I said, well, you know, I'm happy to ask, but what is it that you're asking them to do? They're going to want to know. And I got sent something. I thought, I can't send this out. Then no one's going to understand anything that they've written. It's just written in very scientific language. And I came back and we had a bit of back and forth and they changed it. But again, part of me was thinking, yes, I would have used to write like that. But I've been working with a public partner who is passionate about plain English and has always coming back to me and sending readability tools, helping me to be able to understand how to write for a public audience. And again, that's just become so embodied in me that I didn't even realize where it had come from. But it was only when comparing myself to other researchers that I really understood just the impact that that had on me as a researcher and on all the work I do. And hopefully that is now cascading down to the people, that other researchers that I work with.
That's brilliant. Thank you, Sara. It's really great to hear all those different impacts, not only on the research project, but also on yourself as a researcher. And I didn't do my chairing duties very well. I was meant to ask you to introduce yourself before with your question. So if you don't mind giving a bit of a background for our viewers, and then I might ask you one more question after that, which is, if a clinician or a researcher or a manager wanted to get started with involving patients and carers for the first time, what steps would you recommend that they take? And are there any other considerations?
Okay, so my name is Dr. Sara Garfield, and I feel like John and Della had done quite a good job of introducing me already, but I'm a lecturer in medication safety at UCL School of Pharmacy, and I've also been involved in a lot of projects with Imperial NHS Trust that I have worked with previously. And I am very passionate about patients and the public being a key part of all our research in having full roles and have published in that area. So in terms of where to get started, I think it can seem quite daunting sometimes and intimidating to people about, well, how do you get started with this? And in some ways, my work is about patient and care involvement with their medication, so it lends itself very well to patient and public input. But what I always say to people when they say, well, this is an area and I'm not even quite sure how members of the public can get involved in this, I'm like, well, don't ask me, ask the members of the public. Do you want me to introduce you to some people who actually are involved in projects and might have an understanding of how they'd like to be involved in yours? So my top tip would be always speak to the patients first. Find some people to talk to. It doesn't have to even be an experienced patient and public involvement partner. You just find people, find members of the public, ask them, you know, I've got this project. How do you think that I should be involved? I know that the Patient Safety Translational Research Trust has got their own contacts that people could use for that purpose as well. And often people want to be involved in ways that, you know, we as researchers wouldn't think of. You know, I had a very scientific lab-based projects, and we were talking about patient and public involvement, and everyone was quite skeptical. But actually, you know, getting the public to meet with those researchers, and then they advise them, well, actually, yes, we can advise on what issues are important to patients in developing a vaccine. Even if we don't understand the science of how the vaccine is going to work, we can give messaging about how to give information to the public about the vaccine you're developing and disseminate that in a way that they'll be secure and confident and feel informed about it. And those are two going to be really important aspects. So I think speak to the patients, get their input, and then you'll know what to do from there.
Thank you, Sara. And I echo that I think sometimes researchers or clinicians might be put off by patient and public involvement and they're not sure how to go about it. But I think simply it is a conversation with a member of the public or a carer or a patient. So just starting that dialogue going and understanding people's experiences, that can really help you as a researcher or a clinician understand a topic in a different way. John, would you like to add anything about kind of tips to people out there who are wanting to do patient-public involvement for the first time?
Yes, I think the first thing to say is that if you have the time and you have the inclination to want to, perhaps in general terms of putting something back in response to yourself having benefited from health providers and indeed from health research, that there are opportunities, and those opportunities have increased enormously. And right this very day, there are actually enormously new opportunities, because one of the Imperial College research centers has just this very day received almost 100 million of new 5-year financing to pursue research in no less than 14 different themes related to healthcare. And those are each going to require, hopefully, up to about 5 or even 6 public partners to be involved in joining, as we've talked, in a partnership with the researchers. So there are brand new opportunities. And I know in patient safety that there are continuing opportunities. Indeed, that they are there. You just, if you're willing, you just need to make the right contact, which should be perfectly possible. Probably your own general practice or your hospital will swiftly put you in touch with the right college or university that will lead you towards that. So I think there's no shortage of opportunities, and you don't need to have great knowledge about medicine. I think we've made that clear. You don't really, you just need to have concern not only for your own health, but concern for other people's for the future, your grandchildren, I would say, in terms of research.
Thank you, John. No, I think that's a really good point, that we are all going to use the healthcare system at some point or know people that are, and we all have experiences of it. And perhaps at the beginning, you might not feel that you can contribute to research or improving services, but actually we all do have lived experience that we can share that's seeing something from a different perspective compared to healthcare professionals and researchers. Sarah, I'll come to you. You've got your hand up.
Yes, I just wanted to add one thing that occurred to me listening to you speak, Hannah, is that I would also want to give some advice, if I may, to members of the public who might be approached by researchers who are coming at this for the first time. And I think sometimes because researchers are feeling a bit difficult and maybe not quite secure in how to do this, and it's kind of like we've got to be gentle with them as people who know about how to involve members of the public. And they might say things that we just can't believe that they might think that, because they haven't had that experience, just like I've had experience of I couldn't believe somebody could think that somebody could understand something, but I would have been like that myself once. So I just wanted to add that in as an extra sort of tip for any members of the public who are approached by researchers. Go gently.
And we must be kind and respectful of researchers too, must we not, Della?
I think I've heard the term critical friend being used before. So it's trying to kind of help and give some advice, but always doing it in a kind way. We're probably going to have to round up soon, but Della, I wanted to come to you if
Yes.
you want to.
Yeah, I'm just going to add one final word. Don't just use lay partners or public contributors as wanting to get funding. It's building a rapport. We've been with Sarah, and we're just not going on and on about it, but we build that rapport, because some researchers just come for you on a one-off and you don't hear anything back. So it's building that rapport with your patients, lay members, and public contributors. That's all I wanted to add to it. Thank you.
Thank you, Della. I think that's a really important point. We wouldn't want to encourage any kind of tokenistic involvement. Really do want it to be meaningful. And in the UK, we have the UK standards of public involvement in research, which lay out kind of the standards of how involvement should be done. And it's all about working together, having good communication, making sure that opportunities are accessible for a diverse audience, and kind of capturing the impact of that and feedback, and making sure that the public contributors that you've involved are up to date with what's going on in the project, and after the project they might want to hear how it's going. So I think that's a really good point, and that might encourage the public partners to get involved in other research projects in the future as well. So I think we will round up the conversation there, but I just wanted to thank all of the panel for their brilliant comments, and I hope it has encouraged you either as a public partner to get involved, or as a researcher or clinician wanting to involve members of the public. And you've heard a few examples of how it's really shown impact, not only on the project, but on the people as well. So thank you very much.